ED overcrowding, ambulance diversions, provider shortages, lengthy patient wait times. Is your ED suffering from inefficiency? Maintaining effective patient flow in this increasingly crowded and often understaffed environment is critical, yet it doesn't always happen. In fact, in a recent survey, 65% of healthcare executives said that patient flow is an extremely serious problem, with nearly half citing it among their top 3 concerns. This isn't surprising, given that in a 2005 AHA study, taking the pulse the state of America's hospitals, 69% of urban hospitals and 33% of rural hospitals reported that their EDs were at or over capacity. The emergency department generates approximately 55% of total hospital admissions and revenue. On average, each hospital admission results in approximately $8,500 in revenue, and when one realizes that ED visits have reached nearly 115 million per year, it becomes obvious that effective throughput is key to managing patient admissions, transfers, and discharges. What is the most efficient way to manage ED throughput? The Joint Commission recommends using a patient computer tracking system to follow patients' movements throughout the ED, including how long it takes for patients to get registered, see a physician, be treated and tested, and discharged or admitted. The Joint Commission notes that these systems allow hospitals to determine ED occupancy and capacity in real time. They add that a real-time assessment tool helps determine capacity in units throughout the hospital and identify when the unit lacks any capacity to accept additional patients without risking safety for patients or burnout of staff. How do you find the right real-time assessment tool? VERSES offers Vision, a real-time location information system designed to help hospitals manage patient flow and increase efficiency, safety, and satisfaction. Vision ED Solution helps locate the people and items you need and provides a live snapshot of your ED for real-time decision-making. The VERSES dashboard makes real-time assessment a reality by instantly providing information on ED milestones, current staffing levels, and nurse-to-patient ratios. An overall ED census, including average acuity and order turnaround times, are at your fingertips. Comprehensive reporting tools allow hospitals to analyze processes and compare capacity to staffing levels to better project patient-to-staff ratios. By helping hospitals to better manage patient throughput, Vision ED helps eliminate the need for patient boarding and provides patients with important nurse call capabilities when patient boarding is necessary. The Personnel Call Alert button is an important safety measure, allowing patients and staff to call for assistance from any location. Other important safety measures are implicit in improved communication created through whiteboard messaging, alerts, and transaction history reports, which help close the loop on order and delivery. More than just a real-time locating system, VERSES offers the accuracy necessary to automate room status updates, caregiver assignments, equipment charges, alerts to benchmark exceedances, and patient calls and call cancellation. With Vision, hospitals can change patients' perceptions of ED visits even before leaving the waiting room, simply by ensuring that patients do not wait too long. Upon arrival, ED patients receive badges to track their locations and automate certain events associated with their ED visits. These badges help staff monitor patient wait times and ensure effective patient throughput. From this point on, the patient's location is automatically tracked and details such as primary complaint, current location, and physician assignment are ubiquitously available to the appropriate staff. Patient data appears on the floor plan view and enterprise view. Here, a patient icon is seen in the waiting room. Using custom predefined rules, Vision automatically monitors events and initiates responses to those events. Therefore, as the patient's wait time exceeds the established target, the patient icon changes and Vision automatically notifies the charge nurse. Let's take a closer look at how automation with Vision ED transforms an emergency department visit for acute myocardial infarction. In keeping with hospital patient safety goals, this particular hospital has designated certain badges as cardiac care badges. Thus, when patient Grant arrives at the ED complaining of chest pains and shortness of breath, the registrar recognizes his symptoms and assigns him a cardiac care type badge. Patient Grant's icon now appears on the floor plan as a heart, allowing the caregivers to immediately locate patient Grant and recognize that he requires special and expedited care. This badge will not only track patient Grant throughout his ED visit, but the mere assignment of this cardiac care badge will help by notifying the appropriate nurses and clinicians that a cardiac care patient has arrived, and they should initiate aspirin administration, cardiac panel orders, and any other standard procedures the hospital is required to perform. By assigning this badge, the hospital is set to capture the information they will need to report on with regard to internal process improvement, national patient safety goals, Joint Commission compliance, CMS reimbursement programs, and national hospital quality measures. For example, they are timestamping and documenting complaint identification to room time, room to orders, orders to order fulfillment, aspirin on arrival. Room assignment. The average patient wait time is 3 hours 12 minutes. Extended wait times are aggravating for patients, and unfortunately, the correlation between extended wait times and patient deaths is quite prominent on the nightly news. You want to provide the best possible care. So with heart attacks being the leading cause of death among men and women, patient Grant will skip the waiting room and triage assessment and be placed in an available room. By filtering the enterprise view to display all exam rooms, the nurse quickly identifies exam room 2 as available. Colored shading on the floor plan confirms its availability. Here, green represents an open and available room. When patient Grant enters the exam room, Vision automatically assigns the room, registers the time, and displays the information on the e-grease board, with no manual entry. The floor plan shading in exam room 2 changes to indicate patient Grant's presence in the now occupied room. Clicking over to the patient-centric view, you note patient Grant's room assignment, along with his complaint and triage level. User-definable icons on the floor plan and e-grease board register the presence of staff and equipment in patient Grant's room. Automatic staff assignments. Using predefined rules, Vision assigns the attending nurse. Note the assignment on the patient-centric view. The enterprise view and the floor plan register a doctor entering the room. Based on intelligent business rules, Vision automatically assigns the attending physician. The assignment is shown on the patient-centric view. With business rules applied, when staff exit the room, their icons disappear from the patient's room on the floor plan display and enterprise view, but the appropriate staffing assignments remain available on the patient-centric view. At any time, management and executive-level staff can monitor revenue-affecting KPIs, such as the nurse-to-patient ratio or the potential for ambulance divert status. Order fulfillment. Remember the lab and EKG orders that were initiated the moment patient Grant was assigned a cardiac care badge? As the orders are completed, they automatically register on the patient-centric view. Transfer. Patient Grant's condition has improved, but he will be admitted in order to continue monitoring his condition and for additional therapy. When patient Grant is transferred in the ADT system, Vision immediately notifies the receiving unit's charge nurse and transport tech of the impending arrival. When patient Grant exits the ED, Vision identifies exam room 2 as dirty and sends a page to housekeeping so that the room can be prepared for the next patient. Even though patient Grant is no longer in the ED, Vision has maintained a record of his visit. Now staff can review the time it took to administer care and provide evidence that care was administered in a timely fashion. They can also determine where unnecessary delays may have occurred. Wouldn't you like to be this efficient? Improve throughput, monitor compliance, reduce wait times, improve patient safety, reduce staff workloads. Whatever your need, Versus has the right real-time locating solution for you.